Hi, everyone, and welcome to the special simulcast of the Neil Haley Show and the Ultimate Men's Movement with our host, Dr. Jack Rocco. Hi, Dr. Jack. How are you?
I'm great, Neil. How are you? I hear you're
Fantastic.
down
I'm
in
excited about
Georgia.
this.
The
Yeah, I'm
devil,
in
the
Georgia.
devil went down to Georgia.
Well, I did. Who sung that? You'll remind me. And I know I interviewed him.
Yeah,
The
who's
one
that?
that's not, I forget. I forget whose name. The one devil went down the Georgia song. I don't know. We'll go to that one other time. But our
Okay. All
topic
right.
today is permanent versus temporary enhancement. What's the difference? So I'm really excited to talk to you about this, Dr. Jack, because we talked about enhancement, especially girth. And we've been having these conversations. We've been posting things from your interview with Dr. Loria that's gone viral to other interviews that you've talked about. But we never have talked about because when people say, I want enhancement, there are two differences. So let's start
Yeah.
with the big question. When
Well,
people hear temporary versus permanent enhancement, what do those actually mean, those
yeah,
terms?
I would say that you could probably put them into three categories. One, we'll start off with the surgical, open incision, silicone implants, pumps, various things like that. So, the one is surgical, and we're in the category of non-surgical, which means injections. And of the non-surgical techniques, once again, we can say there's two options there, either a temporary or a permanent. And the we'll start off with the temporary, but I do think this is something that a lot of guys, we've done number of procedures in the last couple weeks. We're growing steadily, leads are coming in, but these are the things that the guys who choose our technique talk about. But so with the temporary filler, this is a Juvederm. Juvederm is the brand name, but it's a hyaluronic acid, which is, a gel that you inject. It's most common in women with their lips or their face, to fill in wrinkles. Um, and the thing with that most women will attest to is that it's something that you have to do every 6 to 12 months, because your body will dissolve that tissue. And these are all in the category of dermal fillers. Okay. And dermal filling is something that, plastic surgery and cosmetic surgery has been doing for years with various things. But the hyaluronic acid is the most common temporary procedure, and the procedures are still $7,000 to $8,000. So the big downside is that it has to be done over and over again. So if you're investing $7,000 to $8,000 every year for this procedure, same in the penis, but if you're doing this every 6 months to a year, it becomes cost prohibitive. No one, so that's one of the downsides. One of the good sides is that, with the temporary filler, you can reverse it. There's enzymes you can put in that will dissolve it. And it's something that if you, just let it run out, if you don't want to continue with it, then if you decide again later, you can start all over again. So, it's not a bad option. And we are working with a vendor to have that option available as well. I'm looking for a reliable vendor for the hyaluronic acid. So that's something that I think we will be doing in the future for those people who want just a temporary trial. And there's nothing wrong with that. The guys down in, a lot of my guidance and mentors and experience comes from between Dr. Loria and as well as the men's group down in Charlotte. And they were doing both, and they just didn't feel that the temporary filler, did as good of a job, I guess. I mean, there's still, you still have to fill the space, and the consistency of the material, just they just didn't prefer it for whatever reason, and they actually stopped doing it at some point. Um, so like I said, I think the temporary procedure, the options or the advantages are that you can reverse it if you want. But if you're going to go through, I encourage people before they do our procedure to really make sure they want to do it, and they're committed, and it's permanent. So but is that such a bad thing? I put that in the good column as well. So The permanent filler, like I said, surgical was one way where you put an implant, and if you want to remove it, you have to do another surgery to open it and take it out. And now there's still scar tissue and scarring. So that's an issue. Injury to the nerves is one potential problem. With our technique, the thing that's different is that it's still a silicone-based product. There are micro particles, in the nanometer range, where your immune system will see those silicone particles, and like they do with anything else, they will engulf it and put in a layer of collagen. Anyone who's had a splinter, you have a splinter for so long, your body will engulf that with it ends up being collagen. Sometimes they'll work themselves out, or sometimes they'll just stay there permanently, surrounded and walled off by the collagen. I had an interesting patient in my ortho office last week. She came in, she was in her 70s, and she had knee pain and a bump right on the side of her knee, and she pointed right to the area. And I looked at her x-rays and I'm like, "You were shot with a BB." And she's like, "What? Are you kidding?" I'm like, "No, were you shot with a BB at some point?" She's like, "I don't think so." I said, "I mean, you could have been a child. Did you used to play with BB guns when you were a child?" And she's like, "Oh yeah, I was a complete tomboy." So at some point in her life, she was hit with a BB gun, hit with a BB, and her body walled it off, and it's sitting there. And now it's getting to the point where it's a little bigger. It's something that she can notice. So I talked to her about it. I said it's a benign thing. Right where you point is right where the BB is right where that swelling is. So there was no doubt about it. So the body commonly does that. And that's what it does with the silicone particles. It's a controlled inflammation. We create a controlled inflammatory effect in the skin, and then it builds the collagen and builds the volume. So that's the advantage of it.
You talked about already why temporary. It makes sense if you're going temporary because you're test driving it. But
Yeah.
they're also the permanent one is I feel from listening to you, and I didn't have this question, but now I do, that it's a little bit safer, the permanent versus the temporary.
Yeah, I think safety is probably comparable. I don't want to
Really, you wouldn't say
yeah, I don't
safety,
want
but
to. I
okay.
don't want to. Like I said, because we're looking to do a temporary procedure as well, um, to accommodate that group of people who want that. So it really is a permanent choice, and it's a financial choice.
I see. It's
And
the expense. The expense is the big thing.
yeah,
Temporary.
right. So I can't really say that, the temporary procedure, the fallow filled, is one company that is out there, or Hyalgan. Hyaluronic acid is the product. So I think they're all safe as long as they come from a reliable and safe and effective company. They're worthwhile. Um,
Right.
I don't see any pro or con. I think they're, with the injection procedures, I'd say they're both on par safety wise.
All right, so let's talk about the difference between the two, kind of breaking down your approach versus one that soon you might be doing the temporary when it comes to the collagen stimulating approach versus what the temporary ones are. What's the
Yeah, so
difference?
the temporary ones is just a filler. It just does exactly that. It fills the space, and that's where you get your added girth. But then over time, that's going to shrink down. With the permanent, what it does is I think there's two advantages to it. One, you can do it in stages. You can start off with one procedure and get an inch approximately of increased girth. You do it a second time, it's additive. So you have that permanent base that's from the first procedure. So in another year, if you want to go up in size, you go up in size. So you can go from 1 inch bigger to 2 inches bigger, and we'll do even three. Beyond three, I'm a little hesitant to do that. I think we start getting into the you know actor quality, and I think you potentially can get more and more complications. We saw some when we were down in Miami with Loria. We saw some that were being redone, that had the temporary procedure, had a number of things. And then you get into, deformity and just a bad appearance to it. It's hard to maintain that anatomic, size. And I prefer the, we did a, we had a guy who, pretty much qualified as a micro penis. He had a very small penis. And he was getting married. His bride is coming over from Morocco. And he had his first procedure, was very shy, very hesitant. As you can imagine, you're coming to the doctor, with this, it's a sensitive problem. So we talked to him about it. We did the first one and he had no pain. Second one, he came back for a second one and, he liked it because it did in the smaller penises, you can get some good length. It gives more tissue, and then, as you have more tissue, you can then add more filler. So his third procedure was even more dramatic. And now he's in a more natural, normal appearance, and he has he's very excited about it. And I said, and now he comes in, he's a new man personality wise. He's like, hey bro, how you doing? He's excited, he's happy. I think his bride is coming in August, so we've been pleased with that. So like I said, it's that additive effect, especially with someone who has a naturally small size, you can increase some length and girth. We don't ever advertise length because it's really the erect length, but it does give, a much stronger appearance of both length and girth. But the primary impact is girth that we look for.
Yeah. One of our topics we're going to have on this podcast is growers versus showers, to have that more of a conversation with you, Dr. Jack, because that's questions a lot of people ask. So
Yeah.
when a patient comes for consultation, what factors determine whether they're a good candidate for enhancement, and how do you help them set realistic expectations?
Yeah, like I said, I think, first and foremost, the expectation of length is something that we set up right from the beginning. It's like you may get the appearance of some added length, but your erect length is your final length as determined by the Lord and Mother Nature, and we can't change that with this procedure. There are other surgical procedures, but they're not really, they're hacks to the system a lot of times, not necessarily giving you a larger member. So it's expectations of what you're there for. And I said we focus on the girth, we focus on the patient's health and safety. I did turn a patient down not long ago. Um, he came in and had unrealistic expectations, and he was a great guy. I love the guy, and I felt bad we couldn't really help him safely, and so we turned him down. But he came in with his wife. She was very supportive. He'd been through a lot, but he had some cardiac issues, and he was a diabetic, and he was even scheduled for a toe amputation, and his sexual function was highly, highly affected. And the risk of circulation and healing was way over the line of what I felt comfortable for.
Mm.
So I was able to, but those are also, I think the morning wood and your sexual function, your you know e- erectile capabilities, are all canaries in the coal mine when it comes to what's your overall health. Because if you have difficulty with an erection, difficulty with that morning wood, that doesn't show up anymore. You could have either testosterone issues or vascular issues, general health issues, metabolic disease. So at least he was there, and I still have the honest discussion with him about, diet and exercise and following up with your cardiologist and your vascular surgeons, that, never hurts. A lot of what I do is counseling of people's health and their general wellness. We run a wellness clinic, that it's based on,
Yeah,
staying healthy longer, staying active longer. It's not the whack-a-mole process of you've got a
exactly.
disease, let me give you a medicine to cure that disease.
Right.
We look on the whole body, getting their weight down. So we do have options for these patients who aren't surgical candidates. We can get them on supplements, weight loss supplements. We can get them on testosterone. So
Mm.
there's multiple tools in our kit to help people wellness wise.
Very interesting. So what I guess I'm learning is basically the candidate's going to be based on what you think health wise and if it's really the expectations or what they expect. Because the
Yeah,
expectations are over expectations. You don't want to bring them in, then they're just totally disappointed
right.
with the
Yeah,
investment they made.
we don't need to be, used car salesmen on this, just get a guy in a car and get him out the door,
No,
you know.
no, no.
It's something that I take very seriously. And I've done my whole career, even as an orthopedic surgeon, I spend more of my time talking people out of surgery, that if they think I'm just going to get the surgery and I'll be fine, but like, well, how bad is it? Do you want, let's balance those risks and benefits. And I think that's my primary job.
So when if people are listening, they want to go ahead and get this permanent enhancement or potentially temporary enhancement. What's the best place? Where do you think is the best place they can reach out to you?
Our website is clearly the easiest, www.theultimatemensclinic.com. Our phone number's on there and everything. I have, we have an office phone that we use
Yeah.
as well. We have the staff available to answer your questions. Usually you'll talk with a consultant, sales consultant at first, who are very knowledgeable of the procedure. They're in the procedures sometimes when watching to see you, and so they're our sales force is well trained and understands the issues, so they can dial you in. And then, they'll frequently say, hey, I'll get a text message from one of the sales reps and they'll say, hey, doc, I got a question. This patient wants to know such and such. I said, well, schedule him for a call, give me his number, and I've done consults through text messages, they're nothing formal. There's no,
Right.
just it's just trying to educate people more thoroughly going into their history on the phone before they even waste their time. Am I a good candidate and what can I expect? I need to also I go into a lot of detail about, is it function or is it just form? Because this part of what we do is a cosmetic procedure. It's strictly looking at the form, the shape, the size, the width. Um, but the function is a whole nother option, a whole
Exactly.
other
Another conversation.
protocol. Do you want medications?
Right.
Do you need testosterone? So
Right.
like I said, what's your age? What's your sexual activity level? What are you looking for? What's your partner looking for? I've had some very detailed, intimate conversations with people, and I like that too. I think it's amazing to be. And I've got people reaching out. Of course, your friends are always your biggest. I'm gonna say it, biggest ball busters, when it comes to
Yeah.
like this. My buddies are, Jack, what are you doing now? And but
Exactly.
then they're coming at me with the questions. Now that we've reached the subject, they're coming at me with the questions. Hey, what do you think about me? So
Right.
it's like they
Right.
they joke about it. It's something that I understand the taboo. I understand the hesitancy. But once that shell is cracked and you get them thinking in a different way, they're like, "Hey, you know what? Hey, can I ask you something?" Always get those questions. Can I ask
Exactly.
you something? Those text messages out of the blue. And I had one this week. Ended up in a big long text conversation about so many things, with an old friend from Altoona. And, so it's guys need a place to talk about this.
Totally.
The whole taboo of sexuality and sex in general is such a taboo. And it seems to me, that women are more open and discuss these things with each other much more freely. Women they're more attuned than us, Neil. We're a bunch of gorillas sometimes, But the guys, they either, the young guys, they're getting myths from the gym,
Right.
misconceptions from the gym, or downright misogynistic
Exactly.
approaches, just things that are not what we're trying to
And
convey.
I think what you do is you bring the straights. Some of these other people are out there. And we're going to talk about more of these topics that are on social media regarding uh, a lot of size conversations and other things for men to look at so that they can understand more about it because they have questions all the time and it's a very viral topic. So we'll be talking about that on the podcast and we'll be clipping the heck out of it. So definitely follow the Ultimate Men's Clinic all over the place. Appreciate it, Dr. Jack.
Thank you,
That,
Neil.
that
I love
was
you. Appreciate everything you do for us.
Oh, you're welcome. That was the special simulcast of the Neil Haley Show and the Ultimate Men's Movement, guys. Take care.